Alright guys, it's Dr. Muhammad. We are back. I think you know what time it is. We are going to be doing another public health sciences question. I'm going to give you about 15 seconds to read this one. Feel free to pause the video if you need more time, and then we'll go through it. So the correct answer here was choice C. Tell your colleague that you cannot discuss any information. Hopefully you got that one right, but let's break it down. You are the physician managing the medical ICU at a large community hospital. During an overnight shift, you admit a 78-year-old male who suffered cardiac arrest due to septic shock. The patient is intubated, sedated, and he is on multiple medications to support his blood pressure, so this is a very sick patient. The following day at a local grocery store, you run into a colleague who is currently employed at another hospital. He mentions that his friend's father was admitted to the ICU at your hospital. Your colleague is asking for an update so that he can, quote, explain it in plain language to his friend. What is the most appropriate response? So based on that question stem, we know we're talking about something ethical, right? We're in public health sciences, we're talking about patient ethics, and more specifically than that, we're talking about patient confidentiality. And this is a really big topic. We want to respect patients' privacy and their autonomy. So what are we going to do here? To correctly answer this question, there's two key pieces of information that you need to keep in mind, and that's HIPAA and PHI. HIPAA is the Health Insurance Portability and Accountability Act that we've all learned about at some point in medical school, and it really modernized healthcare and dictates a lot of the things that we do in healthcare today. One of those things that it dictates is how we handle PHI, or protected health information. So this is a big topic. We're taking care of patients, we're developing a physician-patient relationship. We can't just go spewing all of their protected health information and telling all of their secrets to whoever we want. So how do we handle this kind of thing? The key thing to note when it comes to patient confidentiality and protected health information is that you cannot really disclose any information regarding taking care of a patient. That means whether or not you're taking care of them, what their status is, what their plan is, where they're admitted, when they're going to be discharged. Anything like that cannot be disclosed. If you know that information, this question becomes a little bit easier. If you don't, it may be a little bit more challenging, but let's go ahead and go through the choices. Choice A, provide your colleague with an update on the patient's current status and plan. I think anybody would reasonably say that's probably not appropriate to do. This is a physician that's working at another hospital. They are not involved with your medical ICU. They are not involved with the patient's care, so they really don't need to know anything about the patient's current status and plan. That would be inappropriate sharing of information. So for that reason, choice A is not the correct answer. Choice B, tell your colleague that the patient is in critical condition only. This is something that may be a little bit tempting, right? You're not really disclosing any information about the patient. You're just saying that they're in critical condition. However, even the status, the condition of the patient is not something that can be disclosed. That is technically protected health information. So that would be inappropriate. And that is why choice B is also not the correct answer. One exception to that is sometimes with high profile crimes or injuries, you may sometimes see with social media and the news that physicians may come onto the news and they'll talk about a patient that the public already knows they're taking care of, and they may give a simple statement like, yes, we are taking care of this patient and they are in stable condition, or they are in fair condition. That is an exception to that rule, probably not something that's going to be tested on, but just know that is out there. Choice D, explain to your colleague that you are taking care of his friend's father, however you cannot disclose further information. This choice might also be a little bit tempting, right? Because you're not saying anything about the patient themselves, you're just telling them, yes, I'm taking care of him, but I can't really say anything beyond that, which sounds pretty reasonable. You're protecting the patient's privacy, right? In this case, not really, because like we've said previously, you cannot disclose any information about the patient, including the fact that you are taking care of them or that the patient is staying in your hospital or your medical ICU or anything like that. So even though it might seem small and trivial, even confirming that you're taking care of a patient is protected health information, and that should not be shared with the public or with work colleagues or anything like that. So that is why choice D is also not the correct answer. And then finally here, choice E, advise your colleague to call the medical ICU directly for an update. This would also be inappropriate because again, this physician is working at another hospital. They are not directly related to the patient or involved in the patient's care, should not and cannot receive updates regarding this patient, and that is why choice E is not the correct answer. And that leaves us with choice C, tell your colleague that you cannot discuss any information. Really keep this in mind when you see questions like this. They're going to try and tempt you that it's a family member or it's a colleague or it's a friend and they just want a quick update. You need to keep HIPAA and protected health information in mind. You cannot disclose any of this information without the patient's consent. Of course, there are certain exceptions to that, like if the patient is incapacitated or if there are emergency situations, but generally you want to keep all of this information private. And in this case, we are keeping the information private, and that is why choice C is the correct answer. Hopefully you got that right. If you didn't, I recommend going back to the public health sciences lecture and taking a look at the ethics section. But that's it for now, and I will see you in the next one.